Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Welcome. This is another edition of Medicare Moments, one of the top 10 best Medicare podcasts in the United States of America, as named by FeedSpot, and we really thank them for that. Your host is the incredible Toni King. Hi, Toni.
Isn't that amazing? We have worked hard on these podcasts, and people are starting to find out what's going on. We're telling them how Medicare works and what they need to do to make Medicare personalized for them.
Yeah, and that's why it's important to listen to Medicare Moments and share these podcasts with your friends, because Toni gives these really great tips in the podcast, and you can be prepared, you can be proactive, and you can get the very best out of this government program that we all have to deal with on a regular basis once we turn 65.
And it's only growing. 10,000 are turning 65 every day for about the next 10 years.
Baby boomers.
Baby boomers.
Baby boomers.
10,000 of us are turning 65 every day.
Yep. According to the U.S. Census, there'll be lots of 65-year-olds. So, Toni, we have an email today from Lake Charles, Louisiana, and it comes to you from Victoria there, who says, my 86-year-old mother with Alzheimer's needs 24-hour care and lives in the personal care home. She's enrolled in a Medicare Advantage HMO, and taking her to the doctor is quite an ordeal. Friends have suggested that I disenroll my mother from this HMO and return her to Medicare and use telehealth, which has become popular since the pandemic made medical changes. Financially, it is costing over $4,000 for her personal care home, and she does not qualify for a Medicare supplement due to Alzheimer's because, Toni, I've tried. How do I find a doctor that does use telehealth or makes house calls like in the old days? Is this something that Medicare or a Medicare Advantage plan will pay for? Thanks, Victoria, Lake Charles, Louisiana.
Well, I have exciting news to tell Victoria, and I have exciting news to tell America, because Dr. Welby is back. They do have telehealth. Telehealth is growing leaps and bounds. And because of social distancing, telehealth, also known as telemedicine, has become popular. I have used telehealth myself when I have a sinus issue or something. There's some reasons that you do have to go into the doctor. A lot of doctors are making house calls. Victoria is going to have to talk to her mother's Medicare Advantage plan and see if she can get house doctors to come to the facility.
Okay.
They're really finding out that they can use it and they can do it. So at-home doctor visits via the computer or a device such as your phone is reducing the number of ER visits for patients.
That's really good. And this has really, really grown. I see that you say in your article, medical doctors are not the only ones making telehealth or house call visits, right?
That's right. You've got x-rays, ultrasounds, dentists are now using it. A lot of different people that are using the telehealth
or house call visits, right? So it's something that in America, we got away from it after the 70s, probably the 60s or 70s, maybe 50 years ago.
Probably about the 90s when they really started changing and started the HMOs and the PPOs and all of that. Telehealth is growing. Like I said, I have used it. It's not that hard. There's certain reasons that you may not have to use telehealth. You know, if the doctor really does need to see you face to face. But if you're in an assisted living center or a personal care home or nursing home, the x-rays and ultrasounds and the eye doctors are coming to the facilities to see them.
So they're actually bringing those x-rays and other things to those kind of facilities. They bring them?
Yeah. Nationwide.
Nationwide.
Yeah.
Okay. And technology has made that available as well, because the technology today has shrunk the size of components so they can do things like that that they couldn't do before. This is Medicare Moments. Your host is Toni King, and today we're talking about telehealth, and we'll be back right after this.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Welcome back to Medicare Moments. My name is Jim, and Toni King is your expert on Medicare. And today she's answering a question from Victoria in Lake Charles about her mother who has Alzheimer's disease and how to best get her some kind of care that would be less expensive all the way around. Right, Toni?
Well, it just takes less time. If they help you sooner rather than later, you don't have to go to the ER, but it does save Medicare money. My advice to Victoria and to the Toni Says readers is to ask your elderly family members, primary care doctors, or specific healthcare providers which telehealth provider they use and need to contact. It doesn't matter whether you're with original Medicare and a supplement or a Medicare Advantage plan. They've all got some kind of telehealth that they can use.
Okay.
And that's what you want to make sure that you do. You know, house call doctors are generally board certified, and the providers consist of doctors, physician assistants, and nurse practitioners. They just bring a little bitty office right to your computer or through your phone.
Right. And then you can get these services and you can get them from your home, from wherever you are, actually.
Right. And you don't have to be homebound.
No.
You can just be sick for a day and have to use something like that.
Correct. So these are even good tips for people who may not be on Medicare now, but you have other people in your family and you didn't realize that you can get telehealth. You can do things today you could never do just 5 years ago because the laws have changed so much.
Computers have changed. Look how much has changed in 10 years. It's amazing. You're getting good quality medical care. It's just amazing. And it takes the burden off of the daughter who's sitting here worrying about her mother.
Now, what about this with her mother's options regarding disenrollment from her Medicare Advantage plan with her serious health situation? How should Victoria view that?
Well, she was smart. She went and looked at her options. And because her mother has Alzheimer's, she can't answer the health questions. Her mother can't change to a Medicare supplement.
Gotcha.
She has to stay on the Medicare Advantage plan.
So stay where she is, basically, is what you're saying.
Yeah.
It's important to consider all your Medicare options when you're in situations like this and really other situations as well. And you have to, think about it. Health will deteriorate. And this is where your book comes in handy. In chapter 2 of your Medicare Survival Guide Advanced Edition, you explain carefully Medicare Parts A and B, which can help avoid problems like Victoria is experiencing with her mother.
And we've got other things. The Medicare Survival Guide Advanced Edition about a Medicare supplement, the Medicare Advantage plan, the different rules would help Victoria know how the prescription drug plan works, so her mother doesn't have to get in the donut hole. SeniorResource.com has done a lot to help the Toni Says Medicare clients, people that need the help.
And you might want to go to SeniorResource.com and sign up for their newsletter there as well. You'll get Toni's newest column every week. You'll have access to all of Toni's podcasts there, or actually wherever you like to get your podcasts. But you can refer your friends to Toni's podcast, Medicare Moments, and You can also pick up a copy of her book.
That's right. Just want to thank you, Jim, for being here today. You make it fun.
You do too, Toni. Thank you. And thanks everyone for joining us. And we will see you on our next edition of Medicare Moments with Toni King. Toni?
Y'all have a good day in the US of A. Hi, I'm Toni King, host of Medicare Moments podcast. Join me every Wednesday as I share tips, strategies, and little-known facts I've learned over the past 20-plus years. I put Medicare into people terms, and I want to help you personalize your Medicare, because with Medicare, it's what you don't know that will hurt you. Medicare Moments is available now anywhere you listen to podcasts.